Hello, I am Peter Okwoche. Welcome to Focus on Africa, our top stories. With severe disruption to cross-border trade, East African businesses are counting the cost of coronavirus restrictions. We'll have the latest on their concerns. On International Nurses Day, we celebrate the amazing work of the frontline heroes in scrubs across the continent.
We have no choice, it's from the moment you choose to be a nurse, to practice this profession. I think it's a source of pride to be a nurse, to be able to help people.
Also on the program, we hear from you about the ups and downs of life during the coronavirus restrictions.
What I miss during this pandemic are my friends whom we cannot meet. I miss my teachers and school too. I also miss going out with my daddy.
Thanks for joining us here on Focus on Africa from BBC World News. $6 billion worth of trade within the East African community could be at risk due to the ongoing coronavirus pandemic. That's according to Trademark East Africa, a group that promotes the growth of trade, both regional and international, in East Africa. Restricted movement and increased border checks to stem the spread of the outbreak has affected trade within the region's economic bloc. BBC Africa business journalist Charles Gitonga has the story.
Namanga border, located 180 kilometers south of Kenya's capital, Nairobi, a crucial transit point for cargo trucks between Kenya and Tanzania, a hub of commerce now in sharp focus, not just because of the trade volumes between the two East African neighbors, but also because of the high risk of transmission of COVID-19 among transporters. On Monday this week, Kenya confirmed 28 new infections of COVID-19, 9 of them attributed to truck drivers at the border point. Uganda has also had several cases of truck drivers who have tested positive for COVID-19. Some are Kenyans, as COVID-19 screening and testing became mandatory for truck drivers before proceeding to various destinations across East and Central Africa.
A transporter would move cargo from Mombasa to Kampala and back in 3 days or 2.5 days. But as it is right now, people are moving in 7 to 9 days.
Almost $6 billion worth of goods was traded among East African Community member countries in 2018, and that's according to Trademark East Africa. This compares to $36 billion traded in the Southern African Development Community in the same year. A 2019 report by the United Nations Conference on Trade and Development says the Economic Community of West African States traded $11.7 billion among themselves. This could now be at risk.
It will take longer for you to be able to move goods around, particularly in formal trade that plays a key role in trade within East Africa.
One of the main concerns among the business community within the trading blocs is the lack of a coordinated approach towards the pandemic.
We have tried as much as possible to take into account the different scenarios in the partner states.
The future of this trade is in question, and business people continue to count their losses, even as authorities promise a united path to recovery. Charles Gitonga, BBC, Nairobi.
Well, let's get more now from Mukisa Kituyi. He's the Secretary General of the United Nations Conference on Trade and Development, or UNCTAD, which deals with trade and investment as well as development issues. Dr. Kituyi, the countries in the East African community and indeed many other parts of Africa seem to be caught in a catch-22 situation. On the one hand, trade must go on to fund their economies. On the other, they feel the need to enforce cross-border movement to stop the spread of COVID-19. Is there a middle ground where both extremes can meet?
Well, thank you very much. First and foremost, I don't think there is any competition between security and trade. What needs to be done is what are best practices, what are the best protocols that can guarantee safety issues while also reducing the amount of hurdles that are in the path of movement of goods and services. This is critically important at this time because a lot of the medicines and PPE equipment necessary in Africa requires ground transport. And that means speedy facilitation across borders. It is possible to combine careful protocols on health and faster facilitation of goods transport.
Now, we've used the EAC as an example for this, but I'm guessing the issue cuts across other economic blocs on the continent, including SADC in Southern Africa and ECOWAS in the West.
Indeed. Some of the worst challenges on this are to be seen in places like Zambia. Zambia has very unclear procedures from the South African side, for example, a complete blockage of movement of goods and trucks. On the Zimbabwe side, 14 days quarantine. On DRC side, there is no link to the sea. So you kind of find a country that is marooned there because of the procedures in neighboring countries. But this is a continental problem. There are attempts to solve it. For example, the Northern Corridor effort between Uganda, Kenya, and Rwanda to have simplified, predictable procedures of how to handle drivers and speed the movement to unblock the current jams that we're seeing at the borders.
You say it's a continental problem. Indeed, it's a global problem. But what can the international community do to help? A few weeks ago, the IMF, for instance, announced debt relief for 25 low-income countries, 19 of which are in Africa. Is this enough, or should more be done?
No. You have just asked me about trade facilitation. Actually, the biggest challenges for Africa are twofold. One, having prepared capacity to deal with the health pandemic if it surges, if it spikes. Do we have enough PPE, ICU facilities, medical service provisioners? That is one level. The second is, unlike many countries in the West, we cannot trade off life and livelihood. Many people have such minimal reserves that you cannot totally shut them down. And yet, economies do not have the stimuli necessary. So the IMF amount of money announced recently is a step in the right direction, but there are much, much more ambitious commitments and actions necessary. Number one, a proper and comprehensive standstill on debt service. The necessary policy space right now requires that all African countries suspend their obligations on existing debt, because it's a very acute problem. Countries like Djibouti, debt service before the pandemic is already 60% of public revenues, 20% in Ethiopia, 25% in Ghana. These are phenomenal challenges. It cannot be sustained. But secondly, we need to find a way of subsidizing the livelihoods of those who are dependent on small informal business that have disappeared. But a much bigger challenge is the loss of revenue because of the collapse of international trade networks. If you notice, apart from the collapse in petroleum prices, the disruptions in international export markets are having a direct hit on African economies that are already vulnerable.
Indeed,
Dr.
Kuti, hopefully we'll have you back on the program to talk more about this issue. I'm afraid we've run out of problem now. That was out of time now, rather. That's Dr. Mukisa Kutui, who is the Secretary General of UNCTAD. Thank you very much for your time.
Most welcome.
Now, when it comes to testing for COVID-19, some countries in the world and on the continent have fared better than others. Djibouti in the Horn of Africa is one of those praised for doing well. It has just over 1,200 people who have tested positive there and 3 deaths. But its testing capacity has been credited with keeping this number low. The BBC's Emmanuel Ligunza has more.
Health workers in Djibouti City are on an urgent mission. Since March, the country has been under a nationwide lockdown to try and stop the spread of coronavirus. Public transport has been banned and only those offering essential services are allowed to move around. On Sunday, the government announced a 1-week extension of the lockdown measures, saying the conditions for lifting restrictions had not been met. Initially, many Djiboutians ignored the directive and thronged open markets. Very few observed social distancing or wore masks. But as infections among the community increased dramatically, people started changing their attitudes.
You see, people are now starting to know that there is a real threat and are now taking this seriously.
Despite the challenges, Djibouti is carrying out more tests than neighboring countries. The UN says the Horn of Africa nation is among the top countries in terms of tests per population size.
The strategy that Djibouti has followed from the beginning of the epidemic is a very aggressive contact tracing and testing for the population in Djibouti. So it's not like other neighboring countries where it's a passive testing modality where only people that have symptoms would be tested.
Among those infected in Djibouti are 2 U.S. contractors at Camp Lemonnier, which hosts thousands of American troops. This has led to a public health emergency being declared at the facility. With troop movement now restricted, there are concerns that U.S. forces will be greatly hampered in helping African counterparts in the fight against militant groups in the region. But a U.S. military spokesman has told the BBC that the lockdown measures will not impact anti-piracy and anti-terrorism operations.
At present, there are no U.S. service members at the Djibouti-based cluster who have tested positive for COVID-19. As previously reported, there have been Department of Defense contractors who have tested positive for the virus. We continue to support our forces in Somalia and Kenya and work with our partner nations.
The World Health Organization has warned that the peak of coronavirus in the continent is yet to come and has challenged countries to up the testing process. And it's often pointed out to Djibouti as an example of what nations can achieve regardless of size and resources. Emmanuel Igunza, BBC News.
Let's take a quick look now at other stories making the headlines across Africa and the rest of the world. A fire at a hospital in the Russian city of St. Petersburg has killed 5 coronavirus patients in an intensive care unit. The blaze was apparently started by a short circuit in a ventilator. All the patients who died are thought to have been on ventilators. 150 people have been evacuated from the hospital. Uganda's President Yoweri Museveni has said the country's 2021 general elections may be postponed if the coronavirus outbreak is not under control by July. Uganda, like many other countries across the continent, is under lock and is trying to manage the spread of the coronavirus. There are 122 confirmed cases of coronavirus in the country so far, with no deaths. And China is planning to test the entire population of Wuhan, 11 million people, after a cluster of new coronavirus cases were identified. Chinese state media said the authorities would carry out the tests in just 10 days. There have been at least 5 new infections in Wuhan, the city where the virus was initially detected. These new cases were the first in the area in more than a month. This is Focus on Africa from BBC World News with me, Peter Okwoche. Still to come on the program, we asked, you answered. We'll have more of your videos sent in by you, the viewers, on how you're faring under lockdown. Welcome back to Focus on Africa. I am Peter Okwoche. Today is the International Day of the Nurse and the 200th anniversary of the birth of Florence Nightingale, considered to be the founder of modern nursing. The Global Nursing Workshop stands at 27.9 million, of which 19.3 million are professional nurses. They account for more than half of all world health workers, yet there is an urgent shortage of nurses worldwide, with 5.9 million more nurses still needed, especially in low and middle income countries. The International Council of Nurses estimates that 90,000 healthcare workers worldwide have been infected with COVID-19. Frontline health workers treating coronavirus patients, despite risks to their own personal safety, are undoubtedly some of the heroes of this pandemic. In this report from Senegal, we meet Malamine, an emergency nurse in Dakar. The country has just recorded 2,000 confirmed cases and 19 deaths. He says he's proud of his job, but is aware of the risks for his family. Olivier Weber reports.
It has become a daily ritual. Malamine carefully puts on his protective gear. The 43-year-old emergency nurse is about to enter the quarantine zone of the Pikine hospital in the outskirts of Dakar. This is where patients arriving with symptoms of COVID-19 are isolated while they get tested and await their results. When exiting the quarantine zone, health workers get disinfected. Senegal has managed to keep the epidemic under control so far. Hospitals have not been overwhelmed with cases, But everyone here knows that the battle is not won and that worse may yet come. All over the world, health workers are saving lives, but are also falling ill.
We have no choice, it's from the moment you choose to be a nurse, to practice this profession. I think it's a source of pride to be a nurse, to be able to help people, to be able to help them recover their health.
Help patients while preserving your loved ones. At home, Malamine needs to make sure he doesn't infect his wife and 2 daughters.
Already, long before I leave the hospital to come home, I take my bath to at least minimize the risk of carrying germs. I take my bath and I leave everything that is for the hospital at the hospital. My gown, my work clothes, everything stays in the hospital.
Who else but Dad to teach the correct technique of hand washing? Thanks to the efforts of Malamine and countless others, Senegal boasts the best recovery rate for COVID-19 patients on the continent, but it is still too early to predict how the epidemic will evolve. Olivier Weber, BBC News.
Well, the World Health Organization has warned that a severe lack of personal protective equipment for nurses and other frontline workers is putting lives at risk from coronavirus and other infectious diseases. It's leaving doctors, nurses and those frontline workers ill-equipped to care for COVID-19 patients. But some countries have come up with innovative ways to help tackle this crisis. The BBC's Peter Wakaba visited one such initiative at a university in central Kenya.
Dedan Kimathi University in Kenya is voluntarily producing critical equipment for the fight against coronavirus.
When it became clear that people needed to use sanitizers, the price shot up and the material became unavailable. So we came in to try to make the material available at an affordable price. The mask we are making here will be available at 70 shillings per piece. It is reusable. The N95 mask, which before was going at maybe about 100 shillings to 150 shillings, is retailing at 1,500 shillings. That's almost 10 times, and they are also not available. So if you sell to them a mask that is 1,500, it basically means they will not bother. And that's the kind of situation that we are dealing with. If you tell them that that mask is not reusable, it will be thrown at the end of the day, then we are not providing a solution. The third item that we are looking at is the protective gear for the first responders. There are many. We have the medical staff, we have our security police, who are also often called to respond, the fire brigade, the emergency crews, the community health workers. All those people need to be protected.
The institution is also working on a ventilator to boost the country's critical care capacity.
So we are looking what bridge can we provide where you have support of the respiratory system maybe in the normal hospital ward or even at home, pending an availability of an ICU bed. So that will impact in sustaining life amid shortage of ventilators, and by so doing, reducing the mortalities in numbers that we've seen happen in other countries.
Peter Wakaba, BBC News, Nairobi.
Apart from a dire shortage of PPEs, many health workers on the continent also lack some of the most essential material and tools to help cope with the coronavirus pandemic. Take Sudan, for example. The country was already suffering from a severe shortage of ambulances, and this has been exacerbated by COVID-19. But people are now having to find other means to get the patients some help. The BBC's Mohanad Hashim looks at the situation in Khartoum.
This patient's family has had to resort to using their own car to take him to the hospital. That's how bad they say things have become. They say they waited for the ambulance, but it didn't show up, even though they live in the center of Khartoum. This isn't a one-off case. Many other patients in the capital say they face the same obstacle when trying to get an ambulance. At the moment, there are only 50 ambulances up and running in Khartoum. a city about 9 million people call home. The scarcity of ambulances in the capital was already bad before the coronavirus pandemic, and now it's said to have become worse.
أكيد حاليا في بعض النقص في العربات.
We have a shortage of ambulances as well as staff and drivers. Currently, we're working at less than 50% of our capacity. Recently, we received around 13 vehicles that is going to help us deal with the coronavirus pandemic.
يمكن تكونوا لاحظتوا هي أغلبها شغال في مجال الكورونا.
To help ease the burden, authorities have started using minibuses, having customized them into medical vehicles.
الباص طبعا مكون من سريرين.
The vehicles include 2 beds and one of them is for intensive care purposes. There are also 2 chairs for medical staff.
At the moment, Sudan has more than 1,500 confirmed cases and over 70 deaths. As many as 20 minibuses have been turned into ambulances. There are fears that this might not be enough, but at least it's a start. Muhannad Hashim, BBC News.
Now, once again, it's time for our weekly peek into your lives under lockdown. We can't tell you how much we've actually enjoyed viewing your videos. They've made us smile, dance, and cheer. Let's have another look at how you're all faring out there.
This whole COVID quarantine period has made me miss school so much. The pressure of handling schoolwork at school is so much better than it is handling schoolwork at home and juggling everything else around here.
And I'm really looking forward to going out for recreational activities. So, until the world is rid of COVID-19, stay home, stay safe.
Being on a lockdown has been a bit challenging in terms of the restrictions, but we are looking forward to getting out there, being able to network while still maintaining these guidelines from our government regarding keeping the virus at bay. Maintaining social distancing and hygiene.
Although it's hard, let's keep the guidelines of healthy personality, whereby we are advised to wash our hands frequently with soap and sanitizer. Let's be there, keep faith. Thank you.
What I miss during this pandemic are my friends whom we cannot meet. I miss my teachers and school too. I also miss going out with my daddy.
During this lockdown, we're just staying at home, chilling with kids, watching TV and doing some little school stuffs because we have nothing to do.
At least to have something we can do during a lockdown. But don't forget to wash hands with soap regularly. Stay home, save lives.
The disease itself of diabetes has got its own complications, which may involve the nerves, which may involve the blood vessels, which may involve the...
As a public and environmental health graduate, I'm volunteering to help my community, that is my community health center, and to build the human capacity to make sure that regular public health activities continue, such as reproductive and child health. At my leisure time, I will be in my garden.
Brilliant stuff. Thank you very much to all of you. Just before we go, sources close to the central bank in Egypt have told state media that the country has received almost $3 billion in emergency financing from the International Monetary Fund. The money is to help Egypt manage the coronavirus pandemic that has brought tourism to a standstill and triggered capital flight. Egypt has almost 10,000 confirmed cases and over 530 deaths. That's it on Focus on Africa for today. Don't forget, you can catch me and some of the team on social media. I'm at Okwache, but from me and the rest of the team, thanks for watching. See you again soon.